Welcome to Health Sciences Update. I'm Taryn Roloff, Communications Director for the WSU Spokane Health Sciences Campus. And joining me today is Dr. Deidre Buchwald, who is the Director of the new iReach program. And we'll talk a little bit later about what iReach stands for. She's also a professor with the College of Medicine and a physician researcher here on the campus. So welcome to you. And talk a little bit about your past, because we're very excited to have you here on the Spokane campus, and some of your team members have come with you. So let's hear about what you did before you joined us. I believe it was in September.
Yeah, well, thank you for having me, Taryn. I'm very happy to be at WSU. As you know, I was at the University of Washington for 28 and a half years. I am an internist. I trained at Duke, and then I did a fellowship at Harvard where I learned a lot about biostatistics and research methodology. And then I came to Washington State, having never been here before, and I stayed. So I've been here for quite a long time, however, in the western part of the state. At the University of Washington, I was a professor of epidemiology and also a professor of medicine and a practicing physician. I had a large research center there, focusing to a great extent on health of Native populations, specifically American Indians and Alaska Native people around the country. The kind of work we do is called community-based participatory research, which basically means that we listen to what communities of consumers, whether they're tribal people or other rural individuals, would like in terms of research, what their priorities are. And then we try to work with them to develop programs that help them answer questions and that address their priorities. I had a fairly large team of people, about 50 individuals working with me in Seattle. And we had the good fortune to partner with John Roll here at WSU on a big project that was funded by the National Institutes of Health on rural mental health and behavioral health issues as they affect Native people in the area. And that relationship went very well, and we became friends and good colleagues, and ended up with my getting recruited here along with the rest of my team.
And I've met two members of your team, and it's really exciting because they have brought their families, and they have children in our schools and spouses who are involved in health sciences as well, as far as I recall. And so, as I said, WSU is really excited to have you come over here and join our community and bring your team of experts. So the group that has formed is we've called you iReach, or you've named yourself iReach. It stands for Initiative for Research and Education to Advance Community Health. Right. And so I know that you're actually just meeting this week with your entire team and having a retreat to try to figure out, where you're going to go here in Spokane and in Eastern Washington and across the state as well with this new program. But do you want to talk a little bit about what you're thinking, your reach will be?
Sure, happy to. Well, we think this is a great opportunity to expand beyond just Native health, which has been really our focus for the last 20 years. And we see a lot of opportunities here to work with migrant health workers, Hispanic populations, agricultural workers, and also to link with the addictions programs that are already flourishing here. Mike McDonald is one of the professors who has come over here, and his program is in addictions and behavioral health. So there's a lot of natural linkage there, and in fact, he also works with Dr. Roll and others here already. Glenn Duncan, who will be running the nutrition and exercise program, is an epidemiologist and a nutritionist. He's interested in the built environment. He runs a twin registry, community-based twin registry. So I think there's also a lot of kind of cross-pollination that can happen with people both here at WSU in Spokane as well as in the greater area. We also hope to expand into some of these new areas over the next 5 to 10 years as the campus here grows, and as well as to work with the other WSU campuses. I will say the WSU philosophy is different than the UW philosophy because it's a land-grant school. And so I think there's more interest in really what I call boots on the ground work, really being a part of the community, having extension programs in every county, having experience with people around the state firsthand. So that really fits very well with how we do our work, which is basically, as I mentioned, community-based participatory research, which means that you partner with the people that you're going to be either conducting the research or the educational activities with.
So how do you see yourself participating with the health sciences programs that are already on the campus, the College of Pharmacy, the College of Nursing, the Elson S. Floyd College of Medicine, and then, of course, Eastern has programs here. At this point, can you kind of anticipate how that might work?
Well, I think we're still exploring a lot of the opportunities, and I really do see those as opportunities to partner and collaborate across all these different entities that we're just getting to know. One of our goals is to really meet with people on their own turf, understand what they're doing, see what the common and mutual interests are, and then figure out how do we move ahead in new directions, particularly in new directions for us. I think the medical school offers a really wonderful opportunity exactly because it's just getting off the ground in the sense of a four-year school, because it gives us the opportunity to, I think, influence in some ways what the content of the curriculum might be. For example, I've always felt that public health is something that is never taught in medical schools, and if it's taught, it's usually an afterthought. But it's really a very, very important concept, especially in rural areas. And so working with the medical school and its curriculum development, thinking about policy, thinking about how do we work with the College of Agriculture. In rural communities, and particularly in Native communities, there's a lot of concern about what's called food deserts. People don't have any place to get healthy foods, which leads to a lot of other issues like diabetes and obesity. So there's many groups at WSU that I think we can link with, and that we simply need to have the time to explore what the possibilities are.
Actually, I just interviewed Jay Kennedy from the Health Policy and Administration Program, and he shares, I believe, the building you're in, the Health Education and Research Building. And I think you had said when we talked earlier that health policy is fairly unique in this state.
Yeah. Well, health policy is something that I think WSU can nurture and grow and become really a leader or the leader in the state. You know, every university has strengths and weaknesses, and the University of Washington certainly has a lot of strengths. And I think WSU really has an opportunity to grow in health policy, which is an area that hasn't really been a focus of scholarship at the University of Washington, and has been here, and especially with the Affordable Care Act and so many other changes that are happening, really even month to month. I think that WSU can really step up to the plate and take a really leadership role, especially with people like Jay Kennedy and others that I know are going to be recruited here in the near future.
Very good. Well, you mentioned earlier the work that you've done with John Roll in the past, and assuming there'll be more of that to come. But he really is known for his behavioral research and also around
mental health
and such. Yes.
Substance abuse,
right.
Addictions, right. And Mike McDonald really links with John on those areas. And of course, those are areas of concern to all people,
right.
Really. The rich and the poor and the urban and the rural, they're really cross-cutting issues. We all have behavioral health issues, in our immediate families, in our communities. So I think that them sharing that particular interest will definitely lead to growth in that area. I should also mention that one of the things that we're committed to is capacity building and training. So we've already scheduled a number of grant writing workshops for faculty here on campus. We hope to mentor faculty. We hope to be of assistance to people that are already here doing really good work. And we're also committed to diversity, and I think that's also something that is a campus-wide initiative. And in that respect, two of the faculty that we've brought over are American Indian. Kayumi Sinclair, who's joined us, is Western Cherokee, and Lonnie Nelson is Eastern Band Cherokee. So I think we've doubled or tripled the number of Native faculty that you have here, and we certainly hope to bring others to the campus, as well as think about how to make this a very welcoming place for students across the spectrum.
Very good. Anything else you'd like to add?
Just add that we're really excited to be here, and that we think there's great opportunities really to work across the state with other universities, with Eastern, with Gonzaga, with the University of Washington, and just feel like this is the right environment to make those kind of partnerships happen.
Excellent. Well, thank you for joining us today.
Well, thank you for having me.
Absolutely. Great. And thank you for joining us on this edition of Health Sciences Update.